You find yourself running to the bathroom more often or waking up multiple times a night to urinate or just leaking a little bit when you laugh or sneeze. It's more common than you think. So today we're talking about bladder changes in menopause. Many women are told that it's simply a part of getting older. However, it's really a result of the whole change that happens in midlife with hormones, tissue health, sleep quality, and even the balance of bacteria within the pelvic microbiome. So the good news is you don't have to suffer through it. We're here to help. So you're watching Straight from the Doctor's Desk with me, Dr. Andrea Purcell. I'm a naturopathic medical doctor who specializes in guiding women through the hormonally intense years of perimenopause and menopause. One of the most common and least talked about complaints I hear women talk about is, hey, I'm really struggling with urinary irritation or vaginal irritation, or I'm just peeing a lot more. Some women notice urgency, just waking repeatedly in the middle of the night. Some experience just light leaking with coughing or sneezing. What most women are not told is that these bladder changes are connected to estrogen decline, pelvic tissue changes, and shifts in the microbiome. So it's the urinary and the vaginal microbiome. And there are ways to support it naturally and effectively. So why do bladder changes happen in midlife? Because estrogen does more than just regulate our periods and reproduction. It helps maintain the strength, elasticity, moisture, circulation of all of the pelvic tissues. So as estrogen levels begin to decline, these tissues thin out, dry out, become less bouncy and more sensitive. And this is going to contribute to increased urinary urgency, waking at night because the bladder just doesn't have the bounce that it had. And also, unfortunately, recurrent vaginal or urinary tract infections. And that starts as like pressure in the pelvic region and then escalates. So one of the sneakiest ways that bladder symptoms affect women is through sleep disruption. A woman could think, oh my gosh, I have insomnia. And then once I get up to pee, then I can't fall back asleep because my brain turns on. The thing that I really want to talk about now is the vaginal and urinary microbiome. Few people have heard about the pelvic microbiome. But the vagina and the urinary tract contain whole communities of beneficial bacteria, mostly lactobacillus species, that help protect the tissues from inflammation and infection. And when estrogen is robust during our menstruating years, it helps support healthy levels of protective bacteria. The lactobacillus maintain an acidic environment and it prevents the overgrowth of other bacteria or fungi that would grow there. When estrogen drops, the vaginal pH changes and protective bacteria go away because it's not as acidic and they don't like it. And the tissue weakens and becomes irritated, and the micro tears in the tissue allow for infections to set in. This is one of the reasons why women start suddenly experiencing recurrent urinary tract infections or having vaginal discomfort during midlife. Antibiotics can be very helpful, but they can also further disrupt the delicate microbial balance if they need to be taken repeatedly. So that's why I love a natural and comprehensive approach. Pelvic floor can help a lot. And the pelvic floor muscles, they can relax over time from lack of hormones and also a sedentary lifestyle. Other things can cause laxity of the pelvic floor after pregnancy and childbirth. Constipation can cause laxity, just part of the aging process, lack of muscle conditioning. So when the muscles lose strength, it also will affect the urinary flow, and we'll get some more urgency and frequency than we want. So bladder slings can be an option, but in natural medicine, we like to use surgery as a last resort. So let's talk about some natural and non-invasive support options. Pelvic floor therapy is a type of physical therapy. So there are physical therapists specifically trained in it. that help women condition these muscles of the pelvic floor, retrain muscle coordination, and things like that. Food can be irritating, so becoming aware of the foods and beverages that irritate the bladder and eliminating them can be very helpful. Making sure that you're properly hydrated. So timing matters. When we drink too little water, that creates concentrated urine that could irritate the bladder, or then we overhydrate. Many of us do late into the night, into the evening, and then that causes more nighttime wakings for urination. We can support the tissue health of the pelvic area by proper hormonal restoration, hormonal support, nutrient optimization, and helping hydrate the vaginal tissue, which in turn helps the urinary tissue because they live side by side. Bladder symptoms in menopause are incredibly common, but common doesn't mean that you have to live with them. So too many women silently just go around saying, oh, I have another urinary tract infection. I need to go back on antibiotics again, or just the leaking. It's uncomfortable. These are real physiological changes that can happen in the body. And in many cases, with the right support and addressing it naturally, your symptoms can dramatically improve. So if your bladder suddenly feels different in midlife and you're wondering what's going on, or you have a girlfriend that can benefit from this discussion, please pass this on to her, because menopause does change the bladder and it changes the vaginal tissues, the microbiome, the entire pelvic floor changes in many ways that we just don't expect. But once you understand what is happening underneath the surface, then you have more of a direction to go so that you know how to help yourself and be more proactive. And that's what I love about natural medicine, because that changes everything. You get in the driver's seat with your health and you start driving that bus and you know exactly where you're going. So if you want to learn more about menopause, you can just download my Perimenopause Power Guide. Just see it below. And thanks so much for being here. You can subscribe to this channel or like it. This is something near and dear to my heart, is helping women through the midlife changes. And you're not going to get the whole story in conventional medicine or in functional medicine. But it could be just what you need, or someone that you know needs, to regain the health and the quality of life that you are looking for.